Hi, this is Dr. Fa. Welcome to my online lecture again. We will be learning about the narrative family therapy, and there are 7 parts altogether that discuss about the narrative family therapy. Kindly listen to all so that you are able to connect with the case study that will be discussed via team meeting later on. And please remember to leave a feedback either in this channel or in the ELIP discussion activity, okay? In this part 1, I will cover the learning outcomes of the narrative family therapy, and you can also find another parts of the lecture that covers the major theories of the therapy, Michelle White, the premises of the therapy, the process and outcome of the therapy, 8 treatment techniques of the therapy, the roles of therapists, some unique aspects of the therapy, and the final part of the lecture will cover the comparison of this therapy with other theories. Now, let's have a look at the learning outcomes of this unit. It is hoped that by the end of the lesson, all of you should be able to demonstrate the major theories of the therapy, describe the premises of the theory, explain the treatment techniques of the therapy, and explain the role of therapists. Now, let's start to learn what is narrative family therapy all about. Narrative family therapy is originated in Australia and New Zealand, and it focuses on helping families solve difficulties by depersonalizing them or detach the problem from oneself and rewriting family stories. Narrative family therapy holds the belief that people's realities resulted from their interactions with other people and the world around them, that there is no one objective reality. Problems result when people subscribe to negative, self-defeating views of the world based on their past and present interactions. These views become the stories of people's life. They further believed that people have within themselves all the tools they need to rewrite or restory their life in more positive ways that allow them to live happy in productive ways. The role of the therapist is to help clients use those tools to move out from living negative to living stories where they can avoid and overcome these issues using the strengths that they already possess. Narrative family therapy takes the important view that the person is the expert of his own life. The client is removed from the problem bit and can look at it as one part of a longer life story that give the individual a more neutral perspective. Instead of blame, there's a sense of control over choosing what is most important and perhaps most hopeful in one's own life story. Narrative family therapy emerged from the postmodern approach and movement as a powerful therapeutic technique that encompasses numerous methods specifically designed to help an individual or family to externalizing their problems or identify their problems as being separate from the person. While other approaches to therapy may promote this concept, narrative treatment does so in the unique way of helping the patients turn a problem's situation or history into a story that both themselves and others can view from outside the problem. This allows client to get some distance from the issue to see how it might actually be helping them or protecting them more than it is hurting them. With this new perspective, individuals feel more empowered to make changes in their thought patterns and behavior and rewrite their life story for a future that reflects how they are, what they are capable of, and what their purpose is that separate from their problems. The narrative family therapy has been formulated by Michelle White and David Epstein in 1990, but I will only briefly explain about who is Michelle White in this lecture. Narrative therapy has proven effective in treating a wide variety of conditions from depressions to trauma. Narrative family therapy use externalizing conversations to help people see the problem they report as being separate outside forces that have been affecting them instead of being a permanent part of them.